Drugs administered by inhalation through the mouth must be atomized into smaller droplets than those administered by nasal route, so that the drugs can pass through the trachea and into the lungs. How deeply into the lung they go depends on the size of the droplets. Smaller droplets go deeper, which increases the amount of drug absorbed. Inside the lungs, they are absorbed into the bloodstream.
Remove the cap from the metered dose inhaler and shake well. Breathe out all the way. Place the mouthpiece of the inhaler between your teeth and seal your lips tightly around it. As you start to breathe in slowly, press down on the canister one time. Keep breathing in as slowly and deeply as you can. Hold your breath for 10 seconds to allow the medication to reach the airway of the lung. Repeat the steps for each puff ordered by your doctor. Wait about 1 minute between puffs. Replace the cap on the metered dose inhaler when finished. If you are using a corticosteroid metered dose inhaler, rinse your mouth and gargle using water or mouthwash after each use.
Few drugs are administered this way because inhalation must be carefully monitored to ensure that a person receives the right amount of drug within a specified time. In addition, specialized equipment may be needed to give the drug by this route. Usually, this method is used to administer drugs that act specifically on the lungs, such as aerosolized anti-asthmatic drugs in metered dose containers, and to administer gases used for general anesthesia. Medications administered through inhalation are dispersed via an aerosol spray, mist, or powder that patients inhale into their airways. Although the primary effect of inhaled medications is respiratory, there are likely to be systemic effects as well. Most patients taking medication inhaler have asthma or chronic respiratory disease and should learn how to administer these medications themselves. A variety of inhalers are available.
There are many routes of medication administration. Each route has advantages and disadvantages. Inhaled medications are breathed in. They're in the form of puffers. The pros are their very quick absorption as the lungs have a huge surface area. They can target the lungs easily without affecting the entire body. The cons, they can be misused fairly easily, and medications can end up in the mouth and not actually breathed into the lungs. Some medication examples, Ventolin and Atrovent.
Topical medications are applied directly to the body surfaces, including the skin and mucous membranes of the eyes, ears, nose, vagina, and rectum. There are many classes of topical medications, such as creams, ointments, lotions, patches, and aerosol sprays. Medications that are applied to the skin to produce slow, controlled, systemic effect are also referred to as transdermal.
After washing the skin and drying it, apply the cream or ointment thinly and evenly on the affected area. Gently massage the cream or ointment into the skin until it has all disappeared.
Topical medications are medications that are absorbed through the skin. They are in the form of creams, eye drops, and patches. The pros are that they're easy to administer and non-invasive. Depending on the condition, it can be extremely effective as well. Cons are slow absorption, and few medications can actually be absorbed through the skin. This only means that there's not very many medications that have a topical version. Some examples include cortisone creams, eye drops, nitro patches, and fentanyl patches. The delivery method may vary from patient to patient and needs to be determined on a case-by-case scenario. Thanks so much for watching. We hope you enjoyed it and learned something. But more importantly, have a great day.